So for participants of HIMSS that didn't get a chance to use the HoloLens because there was too many people or it was just being occupied, I thought I'd put this video together to show how the Holo anatomy application looked, both to the spectator and to the wearer of the headset. So let's get into it. To start things off, we do a hand gesture called the bloom, and that brings up this menu. And here we can launch the Holo anatomy application by pointing our eyes and doing an ear tap. And we place the application somewhere. And what this will do is it'll launch the demo.
Welcome to Holographic Medical Anatomy from Case Western Reserve University and Cleveland Clinic. This is a brief, guided demonstration
following my
to show
eyesight.
you the kinds of learning
cool.
HoloLens makes possible. A way to shift from centuries of dissection and 2D illustrations to a 3D systems-level view at true human scale.
Okay, so we need to
Do you see a green disc?
orient the demo. We ear tap.
Imagine you are a medical student. To fully grasp the connections between basic anatomical structures and organs, three-dimensional holographic models can dramatically change the way we learn and the way we teach.
So this is a hologram, so we can walk all the way around it.
When our full holographic medical anatomy module is developed, a virtual narrator like me can guide you through learning objectives. Or you may use it to look at holograms with a group of classmates and a professor to simulate a lab-type setting. You may also use it to study on your own or to participate in class remotely. And even if you don't have HoloLens, you can access this module from a conventional computer screen.
Although you can access it from a computer, I don't think the experience would be as nice without the HoloLens. Next.
Using HoloLens, we can explore whole biological systems individually or together.
Next.
In the skeletal system, we can see the individual bones of the arm and how they connect to the muscles. And we can see the muscles of the face and how they control our expressions.
You can actually look through the skull and all the tissue and how the muscles connect. Next.
HoloLens also lets us examine individual organs and structures in exquisite detail. Here is the gastrointestinal system. We can learn about individual organs.
Next.
In gross anatomy, or even in a surgery, we are often limited to a front-facing view of these organs. With HoloLens, you can walk around the patient for a more comprehensive perspective. Notice how the best view of the pancreas may be from behind the patient model.
Next.
In HoloLens, we can label structures to reinforce learning or support individual study outside of classroom time. Or we can design virtual quizzes to test knowledge.
That should be liver. Next.
With the cardiovascular system, we can observe blood flow.
Next.
Or we can take a look at the heart to see the major arteries and veins.
So this is where we can actually look through the heart into one of the chambers and peer into the valves and see a view that you could probably never see if you didn't have a tool like this. Next.
In the nervous system, we can zoom in for views of the body's main control center, views that are nearly impossible to see in the real world.
Looking up the brainstem into the brain, which is pretty amazing you can do this. Next.
Let's learn about some of the regions of the brain. The occipital lobe processes vision with special sensitivity to edges, contrast, and motion. The frontal lobe controls movement, speech, problem solving, and emotion. The brain stem maintains our oldest, most basic functions, like our heart rate and breathing.
Next.
Now let's take a look at the white matter tracts, which show the major neural pathways that deliver information to and from the brain.
Next.
HoloLens also allows students to see how a disease inside the body may present in physical symptoms. Here we see an example of a brain tumor. Our translucent 3D view helps us to understand which tracts may be affected, and thus why a patient may present with impaired speech or difficulties with motor control. The neural pathways you see here are taken from an MRI image of a real patient's brain.
So if you notice, if I look past the outer layer of the brain matter, I can actually see the inner components of the brain and how that tumor actually sits on a portion of the brain that probably affects motor control. Next.
The systems level view we get from HoloLens aligns perfectly with Case Western Reserve University and Cleveland Clinic's health education collaboration. We are looking forward to sharing our full holographic medical anatomy curriculum with the world to advance medical education.
So that's Holo Anatomy. There's a couple other applications written for HoloLens. Come on. They are Holo Heart. What I like about Holo Heart is it shows a beating heart and it lets you interact with it with a voice beat. Okay, so you can kind of look at this ginormous heart and look into the function of it by cutting into one of the chambers and actually looking at a valve and how they operate. Probably a view that would be very difficult to do without something like this. So you can do other things like rotate it, rotate, spin it around. Stop.